Hi, I'm Dr. Kayathri from Healthy Life Clinic. Today, I'm going to be talking about preventing type 2 diabetes. Type 2 diabetes is a common disease affecting approximately 2.8 million people in Sri Lanka. The numbers continue to rise every year, and the people affected are also getting younger. Diabetes is a chronic disease which requires lifelong care and treatment, and people with diabetes run the risk of developing very serious complications as well. So it is important to look at ways to avoid or prevent diabetes altogether. Studies have shown that a good healthy lifestyle with healthy eating patterns, daily exercises, and ultimately losing a moderate amount of weight successfully prevents 60% of diabetes. So this is a very important fact to remember. Many of us may not know that diabetes can actually be prevented. So it's important to consider this. We don't need any expensive tablets or fancy diets to prevent diabetes. So how do we go about doing this? The first step, of course, is to understand each and everyone's risk of developing diabetes. So what are the factors that could contribute to a risk of developing diabetes? The first and foremost, of course, is a family history of diabetes. So a parent or brother or sister having diabetes makes one more at risk of getting diabetes. A very sedentary lifestyle where there is not much activity in our day-to-day life also puts us at risk of developing diabetes. Being overweight is another big factor. Any history of having had diabetes during pregnancy and any history of having had borderline blood sugars also makes one's risk of developing diabetes quite high. There are other factors, but these are the common and most important ones. Then the next step is to actually check our blood sugar to identify where we stand, whether we have normal blood sugar or borderline or frankly diabetic. This test is called the blood sugar test. It's a simple and almost painless test. It's quick and it can even be done in the doctor's office or even in your own homes, and it gives immediate results. So once we know where we stand, the next step is to undergo a series of guided learning process with the Healthy Life team on healthy, balanced food, the right exercises, and the right lifestyle changes to stay healthy. And the most important thing with all these activities is that we lose a moderate amount of weight and maintain that. And this can help prevent diabetes, keep one very healthy, and even reverse early cases of frank diabetes. So there's a lot more educational material in our website, so please feel free to read more. Do stay healthy always. Thank you.